I want to tell you about a woman named Sylvia, 68 years old, retired librarian, a quiet, careful woman who had spent 40 years surrounded by books, including, as she told me with a small smile, every health book her library stocked. Sylvia was well read. She knew about sodium. She knew about exercise. She tracked her blood pressure at home with a calibrated cuff twice a day and kept a handwritten log. She had been doing everything her cardiologist asked for 3 years, and yet her blood pressure would not come down. Not completely, not consistently. It would drop nicely for a few days, then it would spike again, sometimes 30 points above where it should have been. Her cardiologist had added a second medication, then a third. Still, the spikes kept coming, unpredictably, in a pattern nobody could explain. When Sylvia finally sat across from me, she slid her blood pressure logbook across the table. Months of data, careful handwriting, color-coded entries. I looked at her readings. Then I asked her something no one had asked before. I asked how she drank her water. She looked at me, the way people look at you when they think you've misunderstood the question. "I drink it," she said, "from a glass." I asked her to be more specific. How much at once? What temperature? What time of day? With or without meals? Before or after medications? By the time she finished answering, I had found it. The pattern that was spiking her blood pressure, quietly, reliably, invisibly, hidden inside the most innocent habit imaginable. How you drink water. Not whether you drink it. Not how much you drink across a day, but the specific way you drink it. The timing, the temperature, the quantity, in a single sitting, the context around it, can directly and measurably raise or lower your blood pressure after 60. Nobody tells you this. And after what I learned from Sylvia, I make sure I tell every patient, stay with me. Because what I'm about to share changed how I think about water and blood pressure, and it might change everything for you too. I'm Dr. Soren. I'm a cardiothoracic surgeon with 28 years in the operating room. I have performed over 2,500 open heart surgeries. And blood pressure, the relentless pressure against your arterial walls that determines so much of your cardiovascular future, is something I have spent decades studying, operating around, and trying to help patients manage long before they reach a point of no return. I make these videos because the conversation I'm about to have with you is the one I wish I could have with every patient before they reach my operating table. Most doctors don't have time to discuss hydration mechanics. That 7-minute appointment almost never gets to this level of detail. Today it does. Here is what changes about water in your body after 60 that almost no one explains clearly. Your kidneys are the primary regulators of blood pressure through fluid balance. They control how much water your body retains, how much sodium is excreted, and how much blood volume is circulating at any given moment. After 60, kidney filtration efficiency, what doctors call glomerular filtration rate, meaning the speed and thoroughness at which your kidneys clean and balance your blood, declines by approximately 1% per year, starting around age 40. By 65, most adults are operating with kidneys functioning at 70 to 75% of their peak capacity. Think of it like an old water treatment plant. At full capacity, it handles surges and fluctuations smoothly. At 70% capacity, the same surges take longer to process. Pressure backs up in the system while the plant catches up. That is your aging kidney managing a large, sudden intake of water, or managing dehydration, or reacting to ice-cold fluid hitting an unprepared system. The kidney is slower, less adaptive, and blood pressure responds to every one of those inefficiencies in real time. Studies show that adults over 65 have a 55% higher rate of blood pressure dysregulation. That means unstable, unpredictable blood pressure readings related to hydration status compared to adults under 50. The advice designed for a younger person, drink 8 glasses a day whenever you want, ignores the timing sensitivity of an aging renal system entirely. That distinction, and what to do about it, is exactly what we're covering today. Number 1. Drinking a large volume of water all at once. Here's what surprises most of my patients when I explain this. They have heard their whole lives to drink more water. So they do, in large quantities, all at once, often to catch up, after realizing they have not drunk enough during the day. A full 500 ml glass, sometimes more, in one sitting. Problem solved, they think. But here is what is actually happening inside your body when you do that. A sudden large intake of water rapidly increases your total blood volume, the amount of fluid your heart must circulate. Your heart, which was calibrated for a certain volume, now must push harder to manage the surplus. Blood pressure rises acutely. Simultaneously, your kidneys, working at their reduced post-60 capacity, must process and excrete the excess. That processing takes time, and during that time, the elevated pressure persists. The medical term is acute hypervolemia. That means a temporary but significant increase in circulating blood volume from rapid fluid intake. In a young, healthy person, this is handled within minutes. In a person over 65, with kidneys processing at 70%, the adjustment takes longer. The pressure spike is higher, and it lasts longer. A study published in Clinical and Experimental Hypertension found that drinking 500 ml of water rapidly in a single sitting produced peak systolic blood pressure increases of an average of 11 points in adults over 65, and those elevations persisted for 35 to 40 minutes. Multiply that across 3 or 4 large drinking episodes per day, every day, and you have a blood pressure profile that fluctuates unpredictably, exactly like Sylvia's logbook. The fix is specific. Never drink more than 200 ml of water in a single sitting. That is roughly 2/3 of a standard cup. Set a hydration rhythm, 150 to 200 ml every 45 to 60 minutes throughout the day. Use a small marked glass to measure. Do not drink to quench thirst all at once. Sip, pace it. Your kidneys process distributed intake far more smoothly than sudden surges, and your blood pressure reflects that stability within days. Number 2, drinking ice-cold water, especially on an empty stomach. Let me ask you something. What temperature is the water you drink most often? If the answer is cold, from the refrigerator, from a bottle you keep chilled, with ice cubes, I need you to understand what that temperature is doing inside your body, particularly after 60. When ice-cold water enters your stomach and is absorbed into your bloodstream, it triggers something called a sympathetic nervous system response. That means your body's stress response activates to manage the sudden temperature drop internally. Specifically, your peripheral blood vessels constrict, they narrow, in an attempt to preserve core body temperature. That constriction increases vascular resistance. And increased vascular resistance means elevated blood pressure. Think of it like squeezing a garden hose at the middle while water is still flowing. The pressure behind the squeeze point goes up immediately. That is what cold-induced vasoconstriction does to your blood pressure within minutes of drinking. On an empty stomach, particularly in the morning, when your cortisol is already high and your blood vessels are already in a contracted state from overnight, the effect is compounded significantly. Earlier in my career, I dismissed temperature as a variable. I thought fluid was fluid. Then I began tracking blood pressure measurements in relation to what patients had recently consumed, and the cold water pattern appeared consistently enough that I stopped dismissing it. I should have looked sooner. A study published in the European Journal of Applied Physiology found that consuming 500 ml of ice-cold water below 10 degrees Celsius raised mean arterial pressure in adults over 65 by an average of 8 points within 5 minutes, an effect not observed with water at room temperature. The fix: drink water at room temperature or lukewarm, between 20 and 30 degrees Celsius. This is not complicated. It simply means not refrigerating your water or allowing cold water to sit at room temperature for 20 minutes before drinking. Keep a small pitcher on your kitchen counter, room temperature, filled each morning. Sip from it throughout the day. That single change removes a blood pressure stressor you may have been triggering multiple times daily for years. Have you ever noticed your blood pressure reading higher in the morning after drinking cold water first thing? Write it in the comments. I read every single one. Number 3, drinking water immediately before or during a meal. Here's what the standard advice gets completely wrong about water and meals. Most people have heard that drinking water before a meal helps with satiety and weight control. And for a 40-year-old with a robust digestive system, that is largely fine. But here is what a 7-minute appointment almost never covers for a person over 65. When you drink a significant amount of water, more than 150 millimoles, immediately before or during eating, you dilute your gastric acid. Gastric acid, the hydrochloric acid in your stomach, is essential not only for digestion, but for the absorption of critical minerals, including magnesium, potassium, and sodium. After 60, gastric acid production is already reduced by approximately 30% compared to younger adults. When you further dilute that acid with water during a meal, mineral absorption becomes incomplete. And here is the direct blood pressure connection. Magnesium and potassium are 2 of the most powerful natural blood pressure regulators in the body. They relax arterial walls, counteract sodium's pressure-raising effects, and support kidney function. When you are chronically underabsorbing these minerals because your meals are consistently being washed down with large amounts of water, your blood pressure regulation loses 2 of its most important tools. A study published in the American Journal of Clinical Nutrition found that adults over 65 who consumed 300 milliliters or more of water with meals had measurably lower serum magnesium levels compared to those who drank minimally during eating, a difference that correlated directly with higher resting blood pressure. The fix is precise. Stop drinking water 20 minutes before eating. Drink nothing during your meal except small sips, no more than 50 ml total, if needed. Resume drinking water 45 minutes after finishing your meal. This preserves gastric acid concentration, maximizes mineral absorption, and allows your blood pressure regulation system to receive the magnesium and potassium it needs from the food you are already eating. You do not need supplements if your absorption is working properly. Number 4, not drinking water before taking blood pressure medication. Here's what nobody tells you about the relationship between water and your medications. Blood pressure medications, whether you take an ACE inhibitor, a calcium channel blocker, a diuretic, or a beta blocker, are absorbed through your gastrointestinal tract and carried into your bloodstream by fluid. The adequacy of that fluid at the moment of absorption directly affects how much of the medication reaches your system and how quickly. When you take your blood pressure medication with only a tiny sip of water, or worse, with coffee, or with juice, or dry, you are giving that medication an inadequate vehicle. The tablet may dissolve slowly. Absorption may be incomplete or delayed. The medication's peak effect shift. And if your blood pressure was already borderline, an under-absorbed dose of medication is the difference between controlled and uncontrolled. The medical term is bioavailability. That means the proportion of a drug that successfully enters circulation and is able to have an active effect. Many patients over 65 have blood pressure that appears medication-resistant, when in reality their medication is being consistently under-absorbed due to inadequate fluid at the moment of ingestion. What would I recommend for my own parent? Take every blood pressure medication with a full 200 ml of plain room temperature water. Not juice, not coffee, not a sip. 2 centimeters, measured, consistent, every single time. A study published in the Journal of Pharmaceutical Sciences found that tablet bioavailability improved by up to 23% when taken with 200 ml of water versus less than 50 ml, a difference significant enough in some patients to make a medication that appeared ineffective suddenly perform as intended. Number 5, drinking most of your water in the evening. Here's what surprises most of my patients when I explain this one. They are busy during the day. They forget to drink. By 6 or 7 p.m., they realize they have barely had any water, so they drink heavily in the evening to compensate. 2 or 3 large glasses in the hours before bed. They feel they have balanced the day. They have not. Here is what is actually happening. Large fluid intake in the evening significantly increases the volume of blood your kidneys must process overnight. Your kidneys, which slow their activity during sleep as part of the body's natural circadian rhythm, are suddenly asked to work at full capacity at the precise time they are biologically scheduled to rest. This creates a phenomenon called nocturnal diuresis. That means excessive nighttime urination and the associated blood pressure fluctuations that accompany each trip to the bathroom. Each time you wake to urinate overnight, your blood pressure spikes as you move from horizontal to standing. In a person over 65, with stiff arteries and reduced vascular adaptability, those 2 a.m. and 4 a.m. pressure spikes are not trivial. They accumulate. They damage arterial walls, and they leave you with a morning blood pressure reading that is higher than it should be, setting the cardiovascular tone for your entire day. I have seen this pattern, nocturnal pressure spikes feeding morning hypertension, repeatedly in patients whose daytime readings seem controlled. The nighttime was undoing everything the medications were achieving during the day. And the cause, every time, was the evening water catch-up. A study published in the Journal of Hypertension found that adults over 65, who consume more than 40% of their daily fluid intake after 6 p.m., had significantly elevated nocturnal blood pressure profiles and were 31% more likely to require medication adjustment compared to those who distributed their fluid intake evenly before 5 p.m. The fix: front-load your hydration. Drink 70% of your daily water before 3 p.m. After 5 p.m., limit fluid to no more than 150 milliliters per hour, and stop drinking entirely 90 minutes before your intended bedtime. Set reminders on your phone for 8 a.m., 10 a.m., 12 p.m., 2 p.m., and 4 p.m. Each reminder means 150 milliliters of room temperature water. By 4 p.m., your hydration is complete. Your evenings are calm. Your kidneys sleep when they are supposed to sleep. And your blood pressure, overnight and into the morning, reflects that quiet. Let me come back to Sylvia. After she described how she drank her water, the picture became clear to me almost immediately. She drank almost nothing until midday. Busy with her morning routine, she simply forgot. Then, realizing she was behind, she would drink 2 full glasses quickly before lunch. She kept her water in the refrigerator, cold, always cold, because she preferred it that way. She drank a glass with every meal because she had read it was good for digestion. She took her blood pressure medication each morning with a small sip of water alongside her first cup of tea. And by 8 p.m., realizing she still had not reached her 8 glasses, she would drink 2 or 3 large glasses while watching television. 5 hydration habits, every single one directly affecting her blood pressure. None of them ever discussed in a clinical visit. I sat with Sylvia for 40 minutes, not 7, 40. I gave her a specific protocol. Small amounts, room temperature, distributed through the day, stopping by 7:30 p.m. with a full 200 ml alongside her medication each morning, and nothing of significance with meals. 6 weeks later, Sylvia brought her logbook back. I opened it to the most recent 2 weeks. The spikes were gone. Not reduced, gone. Her blood pressure, for 14 consecutive days, had stayed within 8 points of her target, morning and evening, without a single unexplained surge. Her cardiologist, reviewing the same data, reduced one of her 3 medications. Sylvia looked at me across the table and said, "Nobody asked me about water. 3 years of appointments. Nobody once asked." She was not angry. She was relieved, because now she knew. And now, because of this video, so do you. The way you drink water is not a small thing. After 60, it is a clinical variable, and it has been hiding in plain sight. Let me bring this together simply and clearly. 1. Never drink more than 200 milliliters of water in a single sitting. Space it across the day in small, steady amounts every 45 to 60 minutes. 2. Drink water at room temperature only. Stop refrigerating it, and never drink ice-cold water, especially in the morning or on an empty stomach. 3. Stop drinking water 20 minutes before meals and wait 45 minutes after. Protect your gastric acid and your mineral absorption. 4. Take your blood pressure medication every single morning with a full 200 ml of plain room temperature water. Not a sip, not coffee, 200 ml measured. 5. Drink 70% of your daily water before 3 p.m. and stop all significant fluid intake 90 minutes before bed. Let your kidneys rest when your body rests. Start today with the simplest change. Put a small pitcher, 200 milliliters measured, of room temperature water on your kitchen counter right now. That is your next drink. Not from the refrigerator, not a large glass. 2 centimeters, room temperature, sipped slowly. That is where this begins. Your body has been working for you every single minute of your life. Give it what it needs. It will respond. If this video gave you something real, share it with someone you love. A spouse, a sibling, a friend over 60 who drinks water every day without once thinking it could be the variable their blood pressure has been waiting for someone to address. That one share might be the most important thing you do today. And tell me in the comments, which of these 5 hit closest to home? Was it the cold water you have always preferred? The large glasses you drink to catch up at night? The small sip you take your medication with every morning? I genuinely want to know. Everything I've shared today is general medical information based on published research and my clinical experience as a cardiothoracic surgeon. It is not a replacement for your personal medical care. Every person's situation is unique. Before making any changes, especially to medications or supplements, please have a full, honest conversation with your own doctor. That conversation, informed and unhurried, is exactly where good medicine begins.